Afternoon. Good evening, everyone. It's so exciting to have you connected, participating, and more importantly, engaged in this important webinar today. Thanks for joining. I know that this represents time, your energy contributing to this, but this session is extremely important when we are talking about one of the biggest public health challenges that we are confronting at the moment. That's why we created this webinar series where the WHO Clean Air and Energy for Health will be bringing together important stakeholders, and we are very lucky to have many people connected today. But more importantly, we will be discussing actionable steps. We want all to reduce air pollution, and by doing so, which is more important, protecting our health. So why this matter? I think the figures are already very well known, but I think we need to keep repeating it to make sure that we capture the magnitude of this problem. Air pollution is the largest environmental health risk globally. And as you know, unfortunately, responsible for killing every year more than 7 million premature deaths are occurring every year due to exposure to air pollution. Still, our population, almost 100% of our population is breathing air that exceeds the WHO air quality guideline levels. This is one of the things we need to address very seriously. And the burden of diseases falls hardest on vulnerable populations, as you know, and particularly in low and middle income countries. You all, or many of you, have participated on the conference of air pollution in Cartagena. I think it was extremely successful. You will hear more about the outcomes. 700 participants, more than 700 from 100 countries, and more importantly, committing more than 50 countries and organizations committed to voluntary target of halving the health impacts of air pollution by 2040. And of course, if you want to do it before, it will be very, very much welcome. So the purpose of this webinar and this series is to move from commitments to action. We want to hear how you are planning to implement those commitments. What are the next steps that we need to take, all of us globally and individually and at country level? The different countries and the stakeholders, how we will be acting differently, and defining a roadmap with a clear path for the health sector and the influence that the health sector needs to play on the evidence, on measuring progress, and of course, how we will be strengthening our capacity and ensuring a very strong leadership. So today's goals are very simple. People might say are very ambitious, but I think that they are the minimum. As experts, leaders, and advocates that we are all discussing today, we must champion the collaboration across the sectors. We must take this as an opportunity to share progress, but more importantly, highlighting the challenges in order to be able to address it, and finally, to accelerate impact. So I would like to thank, of course, countries. I would like to thank countries, donors, society organizations, civil society, stakeholders, everyone who is present today and will remain engaged for the future. So with that, I think I will be your moderator for the section. So it's my pleasure to give now the floor to Heather Adair-Rohani. She will take us through the main outcomes of the conference and the reasons why we need to move urgently on a very ambitious and quick way. Heather, over to you. Thank you.
Thank you, Maria. So good afternoon, good morning to others. Thank you all for joining. We're very excited to share with you guys the follow-up that we're doing in the conferences. The conference is just the start of a long journey to clean air for all. Next slide, please. So as Maria alluded to, we'll be talking on the opening remarks. We'll provide some highlights from the conference and get some to hear from some experiences and plans from countries and other stakeholders like some civil society organizations and donors to see where we are moving and how we all need to work together and make actions and collective action for this collective problem. Next slide, please. The first, what we wanted to start on is this: there was two really key, big issue, I would say milestones for air pollution and health. One was the conference, and the other is this updated roadmap for an enhanced global response to the adverse effects of health of air pollution. This was a very key moment where member states really agreed to take forward action on air pollution and health to protect people now and in the future. Next slide, please. So a quick step in history as to what this roadmap means. And what is the health sector engagement to this is back at in 2015, the first ever World Health Assembly resolution was passed, and it's the only resolution on air pollution and health. And it was passed unanimously by all member states, where it basically identified and it recognized air pollution as a very important health risk, and really also highlighting the important role that the health sector has to actually tackle it. This particular resolution called for a roadmap for the following year to be presented to the World Health Assembly, essentially all ministries of health. Now this roadmap itself expired in 2019, and so we have been working in the Secretariat to update this roadmap, which was really meant to complement and be complementary to the conference itself, as this was a way to really make sure that governments themselves were all committed, and all ministries of health were committed, and we again updated specific actions that member states need to take, and really outlined what it is the WHO Secretariat will do to support member states in their commitments to clean air. Next slide, please. So this particular roadmap is broken down into four particular categories as the previous roadmap, where we define specific actions, outputs, and outcomes for each of these key areas. The first being knowledge and evidence. So this is where we actually need to have these normative guidance, where we bring and synthesize the evidence, and that we make sure that we convey that. Then previous slide, please. The following one is really about measuring progress, knowing where you are and where we want to go. So this really highlights what the key role of the health sector has in terms of monitoring the health impacts of air pollution now and in the future, and also monitoring the effectiveness of various interventions to make sure that we can scale up solutions that really have the most benefits for health. The third category that's outlined in this roadmap and outlines activities is really on how we as the health sector can build the institutional capacity. So this is making sure that the health sector, whether that's doctors and clinicians, those working in ministries of health, those community health workers, they know and understand the health risks of air pollution, but they can also provide guidance on the solutions to prevent exposure and protect health moving forward. So this was a key aspect category as well. The final category of the roadmap is one around global leadership and coordination. The voice of the health sector is very strong. It's a very trusted voice, and therefore we have a key role to play in making sure that the world is on target to really achieve clean air and move this forward. So we need to advocate, but also provide the evidence and knowledge to actually make the changes that happen, as well as the political leadership, as that is an important and key aspect to really drive action and progress on the ground. In addition, it highlights the important role of really engaging with other sectors to make sure that this is a problem that we are all addressing collectively and synergistically to make sure that we can maximize efficiency and maximize impact on the ground. Next slide, please. This is just a quick show of what this roadmap actually says and outlines in one of the key categories. We have this for each of the categories in an annex of the roadmap. Essentially, for each of these categories, we provide the actions that need to be taken to actually achieve an advanced clean air. What are some of the specific outputs that would be achieved with those actions and leading to the ultimate outcome? Next slide. In addition, this particular roadmap, which was not in the previous roadmap, includes a voluntary target. This was a very big key moment, as basically the ministries of health have signed on to working to achieving a 50% reduction in health impacts from anthropogenic sources of air pollution by 2040. This is an ambitious target, but a doable target. And we're really making it marked to 2015 baseline values, as that's when the roadmap, the initial resolution was put forward, so that we can monitor progress to what's happened since that roadmap and since the health sector came on board to achieving clean air for all. Next slide, please. Now, why this voluntary target was chosen is that it's relative. The anthropogenic aspect really makes sure that we're all working and trying to address the sources of emissions from different sectors of air pollution, so that we're not caught in this kind of aspect that there's natural sources, that we're really being compared to where we can have action and make changes via policy. It's also aligns with other global efforts and initiatives out there, such as those from the World Bank, which was recently launched with their Clean Air Initiative. And also it really helps us to look at and helps us define what are the specific health outcomes that we can see the most. So for example, we'll be monitoring at a variety of different ways of monitoring health impacts for member states to choose, but we're really looking at all-cause mortality as the main indicator to really monitor these reduction of health impacts. In addition, this particular target is really done at a country level. So it's the demographic changes, et cetera, will be accounted for in relative to those of the countries experiencing. And a final point to note that in a few places of the world, there's actually countries that have actually achieved WHO guidelines, and so, or very close to, and so a 50% reduction may be very difficult to do, but we will still encourage them to make progress and maintain their clean air in their communities. Next slide, please. So this roadmap was presented at the World Health Assembly, initially at the Executive Board back in February, and it was at that point proposed to be put forward to the World Health Assembly this past May. It was put forward in the World Health Assembly, and it was adopted successfully with the resounding support from a variety of member states who really appreciated having this clear definition and clear pathway for the member states to move forward in the health sector, as well as this ambitious target. Next slide. So on one side, we had this great movement towards where we have the policy and the governance around member states and ministries of health committing to clean air. And then, but we know that it can't be the ministries of health themselves. We really need to share this with a broader community to really gather the strength and the great work of partners and get them on board to this pathway to clean air via the conference. So we'd like to give you a quick sneak peek. Well, it's not a sneak peek, it's a preview of a summary video that we have from the conference. So it's a very quick video, but I think it captures well the great movements and great exciting activities we had at that. So over to you, Aubrey, if you would like to go ahead and share the video.
Estos 3 días estamos organizando la segunda conferencia global sobre contaminación de aire y salud. Tenemos aquí en Cartagena 750 participantes que han querido sumarse a este esfuerzo de acelerar esta acción.
This meeting is about one thing. Air pollution is killing us.
Es de un trabajo muy fuerte, intersectorial, no solamente desde el Ministerio de Ambiente, el Ministerio de Salud, sino también con los ministerios de Energía, Transporte y sobre todo las autoridades territoriales en los departamentos, los municipios de los países y acá en Colombia para poder implementar intervenciones que están basadas en evidencia que van a tener un efecto en mejorar la calidad del aire y evitar estos impactos en la salud.
But breathing is the most fundamental right that we all deserve. Try not breathing for 2 minutes and see what happens to you. There are always excuses. People don't want to give up their cars, they don't want to use buses, they don't want to stop cooking indoors, or they don't want to stop wood burning. That is not true.
La selva amazónica, ustedes saben que es uno de los pilares climáticos del mundo. Si se acaba esa selva, llegamos a un punto de no retorno, no para la población colombiana, sino para toda la humanidad.
Porque aunque parezca contraintuitivo, no todos respiramos el mismo aire.
We need to leave this room or this wonderful auditorium with progress, with ambition, with commitment, and definitely very much decided to change completely this massacre that air pollution is representing for our population.
Thank you, Aubrey, for sharing that. So that video captured a little bit of the great activities that went on at the conference. And before I go to give a few highlights about what was next after the conference, I do want to give a very big thank you to many of the partners that really helped support this conference happening. As you know, we co-hosted this conference with the government of Colombia, so a big thanks to them. But a big thanks to many of the donors and support from different partners, such as the Spanish government, NORAD, other UN agencies, WMO, UN partners, World Bank, France, Ministry of Foreign Affairs of France, as well as the Netherlands. So a very big thanks to all our partners to make this happen, as it's something that we couldn't have done on our own. Next slide, please. So quickly, just a summary, you saw here that the conference itself, we had 30 sessions over the 3 days with 26 side events organized by UN partners and others, pre and post conference, and with about 700 participants. At one point, we actually reached over 1,000 when we had the honor of having the President of Colombia come and speak. So this was these are big numbers. What was very key about the conference is actually we have commitments and pledges, next slide please, from a variety of countries and other stakeholders. We'll hear from some of them and then later on in this webinar series. But for example, we had China, we had Colombia, we had Brazil, we had the City of London, we had civil society organizations, all really committing to this target, this pledge of a 50% reduction in health impacts from air pollution by 2040. Next slide, please. So indeed, I wanted to flag that this target was a common target. As we mentioned before with the roadmap, where we had the Ministries of Health sign on to this voluntary target with the roadmap, we had the same pledge included in the target, included in the conference as well, where we had stakeholders there and willing to sign up and make their actions and steps towards achieving a 50% reduction. This pledge is still open. There's still opportunity. We're keeping this open until September 7th on Clean Air Day. So we really encourage other stakeholders and partners to continue to pledge towards action. Next slide, please. And to do so, we will be tracking progress. We'll be tracking progress in areas of governance, policy, and finance, particularly the health sector, but we'll be working with other UN partners to track the progress of other sectors like environment and energy towards achieving this. We'll be tracking the health sector's role in institutional capacity. We'll be tracking how many health sector professionals are being trained on air pollution health, what kind of air quality, health impact assessment trainings are going on, etc. We'll also be ensuring to monitor the leadership and advocacy of the health sector. What's the awareness raising? How can we really communicate more broadly? How can we integrate activities across the UN system and across member states, across cities, to make sure that we're working together towards this common objective of clean air for all? Next slide, please. So indeed, we had the conference itself. We had over 50 stakeholders make commitments representing cities, countries, donors, civil society organizations, and academic institutions. As you know, this is really something that we all need to work efforts toward. So indeed, we're going to be tracking and continue working, but we want these numbers to get bigger. We will really encourage you all to make continued pledges. Next slide, please. And another key aspect of this conference was we had a call to action that was put forward first. We had more than 47 million voices of the health community calling for urgent action on clean air. This is a huge number. The health sector's there and ready to support. Next slide. This particular call to action is available online and was launched at the conference. It was launched a little bit before the conference, but presented at the conference itself. And it talks about the health sector's call to raise awareness about air pollution and connections, build momentum for actually achieving the clean air commitments, and make sure that we as a health sector lead by example, ensuring that clean air for all is a reality. Next slide. So some key next steps for WHO. is we're going to continue the regions ourselves. We're working with our regional offices for them to establish their own roadmaps for their particular local context. We continue to disseminate information, products, and tools. We're continuing to integrate the health agenda into other global and health and energy and climate agendas. For example, COP30 is coming up. We have the UN General High-Level Assembly on Non-Communicable Diseases to make sure air pollution is recognized as a risk factor for vulnerable populations, and other initiatives, complete global initiatives. And then we'll continue to strengthen the capacity of our health sector and monitoring progress towards achievement of clean air for all and its impacts on health. Next slide. We'll be working with our UN partners, has already kicked off with, for example, with World Meteorological Organization, United Environment Program, et cetera, to really make sure that we're tracking progress towards these commitments now and as we achieve 2040. Next slide. And finally, we have some really key, quick turnaround projects that will be coming out soon that you need to stay tuned for. We have the SDG 7 Tracking Progress Report. The new one will be launched next week. We have a science and policy summaries that will help to inform background for the conference, but also serve as an important information resources for now and in the future on various topics. We launched over the summer in 2 different batches. We have a new report on children's health and air pollution and cooperation, developed in cooperation with UNICEF, being launched in the coming weeks, as well as a huge new set of infographics and videos that we encourage all of you to use and to really communicate and share on social media and other platforms to make sure that we as a community can really call for the clean air to protect health. Next slide, please. So I don't think we will probably have time for questions at this moment, but we'll take them at the end. But we would like to now turn, next slide, to our partners online to hear some of the experience and plans of countries, some of the funding organizations, city organizations, et cetera, to advance this, and civil society organizations to advance this agenda forwards. So I think we first will hear from the government of the Philippines, but over to you, Maria, to take on the moderating.
Thank you. Thank you very much, Heather. And thank you all for the fantastic video, the participation on the conference. And of course, I join Heather on thanking all of the key supporters that allow us to advance as much as we are advancing. Keep your questions maybe for the chat group. I see something very exciting from Simon saying that breaking news that Rosemont Pisidera will be reintroduced for the parliament in UK. So let's see what's happened there. But in the meantime, we say it, we have a very important mission and target here, not ambitious enough in my opinion, but let's hear all those commitments to clean air. What are the next steps? And let's start hearing from the Philippines. I will be very pleased to give the floor to my friend, Dr. Maria Sonabela Narna, the Environmental Health Division in the Philippines. And she will tell us how they are planning or implementing already, I hope, the target that they have committed at the conference. So, Maria, you have the floor, please.
Thank you, Dr. Maria. Thank you so much for this chance to speak before this event of WHO. So, hello everyone. Good afternoon from the Philippines and good morning and good evening to other parts of the world. I am Sonabel from the Department of Health in the Philippines, representing the Philippine team for the DOH and Department of Environment and Natural Resources, or we call it the DNR. I'm using the background I used during the conference we had in Colombia. Thanks to the conference secretariat for making my job easier now because I have already the format of my background slide. Sharing also some of my many pictures during the conference. The Philippine team was lucky then of having a chance to take picture with the star for all seasons. We have Dr. Maria. See my picture issues on that top part of my slide. And the rest are my colleagues and acquaintances during the conference. Next slide, please. Thank you. This is my country, the Philippines. In this slide, you can see the air pollution challenges in the Philippines we are facing now. Based on the 2021 National Emission Inventory by SARS, the majority or 56% of the pollutants came from the mobile sources. So please see in the slides the traffic we have. One of the main roads in Metro Manila, 35% were contributed by stationary sources such as power plants and factories. Next slide, please. The rest, 9%, were from area sources such as construction activities and open burning of solid waste. And of course, one of our major sources of air pollution is during the eruptions of our active volcanoes. Next slide, please. But thanks God, we have the Interagency Committee on Environmental Health, or we call it IASE, to talk and collaborate these air pollution challenges. So the picture on your left side is our recent Interagency Committee meeting held last May 16. So we have the chair, the Department of Health, represented by our director on Disease Prevention and Control Bureau. Then we have also the representative from the DNR, or the Department of Environment and Natural Resources, and we have all the present, the 10 member agencies, in addition with the Department of Health as the chair and the DNR as the vice chair. So we have also our partners from the WHO, from UNICEF, and other concerned partners. So ISA, wait, a little background about the ISA. Okay. ISA was institutionalized through an executive order in 1991 and composed of all those agencies with 12 logos. Again, as I've said, the DOH as the chair and the Department of Environment and Natural Resources as the vice chair. Next slide, please. We have the National Environmental Health Action Plan, or NEHAP 2030. That's the latest one that we have, in which the ISA provides the overall guidance and oversight on the implementation, assessment, and improvement of all at all levels of the government, from the national, regional, provinces. So NEHAP 2030 is being led now by the Department of Health and DNR, and in partnership with the WHO. This is the country's planning and reference document that sets the strategic direction and the promotion of environmental health. It identifies the strategic initiatives and investments on environmental health that must have a collaboration that should be pursued from 2023, the moment we crop our NEHAP, until 2030. So this is now the roadmap of our environmental health, which include the air quality and health from 2023 to 2030. Next slide, please. So you can see many partners that we had for this NEHAP. All those on white boxes, those are our partners in the crafting of the NEHAP and in the implementation of the NEHAP. So not only the 12 government agencies, but we have also the international and local partners, and some from the academy. Thank you. Next slide, please. So NEHAP has 6 themes or sectors, one of which is the air quality and health. The climate change is cut across all the 6 sectors. The lead agency for this is the DNR, and the vice chair is that for the health sector, for the air quality and health sector, the lead agency is the DNR, and the vice chair is the Department of Transportation, or the DOTR. So in the NEHAP air quality and health sector, we have prioritized the environmental health issues such as shown on the screen, the one on the green box, which is the top priority issue is the increasing burden of disease from outdoor and indoor pollution as the sources of our air pollution. So we have also set the sectoral objectives from that prioritize health issues. So this is the format of our NEHAP. We have different chapters of the NEHAP, but all the 6 sectors that we have, including the air quality and health, we have the action plan. That's why we call it the National Environmental Health Action Plan. Next slide, please. So during the updating of the air quality policy, like the particulate matter 2.5, we have utilized the ISA as a venue of discussion and coming up with a resolution which was used as one of the bases in signing the policy by the Secretary of the Department of Environment and Natural Resources. So it's the ISA that gives recommendation that discuss on what the guidelines should be from because we have guidelines from 2020 until 2025, 2028 to follow for the PM 2.5. So the policy was given a resolution by the ISA to be signed by as one of the bases for the signing of the policy by the DNR Secretary. So this is the timeline how we come up with that air quality index breakpoints. Next slide, please. So the specific actions being undertaken now is that the DNR, the EMB, and members of the ISA and other stakeholders are reviewing the existing national ambient air quality guideline values and the development of the new guidelines values for the hazardous air pollutants, or we call it HACCP. Attaining the HACCP guideline values means progress also in improving the air quality and, of course, improving the health outcome. Next slide, please. So this is the method we're using now in updating the 25. We are prioritizing the 25 hazardous air pollutant parameters. So for phase 1, 2020 to 2021, these are the gases concerned. For phase 2 and phase 3, and this is still currently being undertaken. So for the next slide, so this is the method that we are using. We do the systematic review of HACCP guideline values, then the determination of the nationwide HACCP levels. Then we will also do the health risk assessment. So this is the meta-analysis question. What is the lowest levels of exposure for which the HACCP poses a considerable carcinogenic risk? So this is a long way to go. We have a HACCP roadmap from 2021 to 2033. So I hope by 2040, which is our commitment for the reduction of health impacts, 50%, by the implementation of this critical hazardous air pollutants, we could also reduce the health impacts by 2040. Okay, next slide, please. So we are also updating the Department Administrative Order 2000 because this is now old 2000, which is the Integrated Air Quality Improvement Framework, Air Quality Control Action Plan. So just like any other country, the Philippines has its own Clean Air Act, also known as the Republic Act 8749, which was signed in June 1999. This is, of course, to protect and advance the right of the people to a balanced and healthy ecology. Next slide, please. And lastly, I think we are adapting, our team, the Philippine team is adapting the intersectoral and multi-stakeholder action, which is crucial for the successful development and implementation of air quality policies, including achievement of the goals and targets for the 2030 Agenda for Sustainable Development. Since air quality is influenced by policies formulated in diverse sectors, whole system approach are needed for protecting the public health. I think the last slide is just to say maraming salamat, and this is the slogan of the Department of Health. Sa bagong Pilipinas, bawat buhay mahalaga, in English, because in the new Philippines, every life is important. And also sharing with you the slogan of the Department of Environment and Natural Resources that we should go green to breathe a clean air. Thank you very much.
Thank you. Thank you so much. And I love the slogan. I think with your permission, we should use it broadly, and we will take as well advantage of your presentation and the definition of the steps that you are making. This is a very good experience that I'm sure that many of the numerous participants will be taking advantage of. And now we move to another presentation, an important one as well, from another perspective. In this case, will be NORAD, and we are very happy to have the head of the Global Health Section, the Norwegian Agency for Development Cooperation. And my pleasure to give the floor to Torgeir Vasasan. I think I pronounced it wrongly, but I did my best with a Spanish accent. So Torgeir, over to you.
Thank you, Maria, and that was a perfectly acceptable pronunciation of what I know is a tricky Norwegian name. So good morning, good afternoon, good evening, everyone. It's great to see the engagement in this webinar and great to see the momentum in the follow-up to the conference in Colombia and the engagement on this topic. So thank you, first of all, for the opportunity to listen and learn and join in this webinar. And secondly, thank you as well for allowing us to share a little bit of Norway's experience, our plans, and some thoughts that we have on our common efforts to reduce the negative health effects of poor air quality. I think it's clear that we have enough evidence that air pollution has a detrimental effect on human health. There's no need, I think, for me in this forum to repeat all the facts around that, but we know that outdoor and household air pollution in combination kills around 8 million people globally every year. The costs to our societies are huge as well, amounting to 5% of the world's GDP due to health impacts, lost productivity, and reduced life expectancy from outdoor air pollution. So those are massive figures and numbers that we need to keep in the back of our mind. Now, I represent a country where the risk of premature death from air pollution is among the lowest in Europe. Norway applies the WHO standards and has actually surpassed the goal of EU's zero pollution action plans. However, despite good progress also on air quality standards, there are still differences within the country, and not all our cities and communities have reached these targets. We also know that air pollution is not confined to national borders. Norway remains committed to the Convention on Long-Range Transboundary Air Pollution, and we applaud the approval of the updated roadmap that was referred to. And we think that although in these times it's felt to be under pressure, we know that multilateral cooperation is more important than ever. Not only to develop and agree on standards and goals, but also to be able to join forces in supporting those countries that suffer from the worst effects of air pollution. We know that almost 95% of all premature deaths due to air pollution occur in low and middle income countries. It affects disproportionately the marginalized communities, those with chronic diseases, children, and the elderly. So it's clear to us that air pollution belongs firmly on the development agenda. We're committed to continue to integrate investments to reduce air pollution through the various development programs supported by Norway and managed by NORAD. We think that the updated roadmap can guide us in our response. The roadmap underlines the importance of research and air quality surveillance data, strong institutions, trained healthcare workers, and health leadership, strong health systems. It focuses also on reaching vulnerable groups and equity, and on, not least on engaging with other sectors for action that can have major health benefits. In our development programs, air pollution is especially relevant in the sectors of health, but also the sector of clean energy. So I'll just provide a few examples of what Norway is currently supporting and working on. First of all, within the health sector, we're engaging in international cooperation through the Norwegian Public Health Institute, focused on strengthening public health institutions in selected countries to strengthen their role and capacity to provide research, evidence, and advice on public health issues, including air pollution as a major topic in that space. We're also focusing on health information systems and the importance of integrating climate and environmental change data into health information systems, first and foremost through the platform DHIS2, which is led by the University of Oslo. And finally, of course, we are supporting the WHO work on environment and air pollution and have been doing that for more than a decade. If we move to the energy sector, which is another development priority for Norway, a few examples of how we're supporting the work towards cleaner air in the energy sector. First of all, we're providing support for emerging renewable energy businesses in developing countries. We aim through that to provide access to clean energy, create jobs, and reduce poverty. We're also engaged in what we call an Energy for Development program, which leverages technical assistance and exchange between the Norwegian energy sector and its various institutions and national governments in low and lower middle income countries to plan, regulate, implement, and maintain sustainable energy solutions. And finally, we know that more than 2.3 billion people lack access to clean cooking facilities worldwide. We have committed to approximately $50 million USD to support clean cooking in sub-Saharan Africa in particular. We think that there are some reasons to be optimistic looking forward. We know that deaths from household pollution has been reduced steadily over the last 25 years. The World Bank's flagship report on air pollution, which was launched earlier this year, suggests that halving the number of people exposed to unhealthy air pollution globally by 2040 is both feasible and affordable. So it's possible. And we know that there is now commitment to supporting the implementation of the WHO's updated roadmap. And we know that awareness and evidence of the negative effects of air pollution to health, well-being, and economies in low and lower middle income countries is growing, and that's driving action and ownership at that level. Finally, we think that understanding the linkages between climate, environment, air quality, and health is really critical to finding solutions to these challenges. That requires close collaboration among the main actors and across sectors. So, in conclusion, it's clear we have the evidence, we have the momentum, there is an understanding of the need to step up efforts to improve air quality, mitigate climate change, and enhance adaptation. And we look forward to continue to being a part of that journey and those efforts. Thank you for your attention.
Thank you. Thank you so much. And thank you for the strong partnership, support, and strategic engagement on this program for, as you say, more than 10 years. We will not be here without your critical help. So thank you very much. And thanks as well for this issue related to access to clean sources of energy at the household level or at the global level. So this is extremely important as well. And we count on you for the implementation of the roadmap. So thank you again. And I hope the participants, no pressure, but for you speakers, but the number of participants is increasing. So you are doing something very good. Let me now, and again, no pressure, to give the floor to another very important supporter and strategic partner, Wellcome Trust. And we are very happy to have Rachel Huxley with us, and she's the head of mitigation for climate and health at Wellcome. So Rachel, please, you have time to share with the participant your experience and your contribution and engagement. Over to you. Thank you.
Thank you so much, Maria, and thank you to WHO for the leadership on this issue, ongoing and incredible leadership, and for hosting such an amazing conference in Cartagena, where we saw the commitment, the courage, and the leadership of this community to fight for clean air, and it's fantastic that you're continuing the conversation and the efforts, and as you say, to have so many people on this call and hearing about, and seeing in the chat the breaking news and all the commitments and all the work that's going on. So, thanks to you and thanks to everyone here. So for anyone who doesn't know, Welcome is a global charitable foundation working towards a healthier future for everyone. And we support science and research to support and solve urgent health challenges that we're all facing. And by way of a sort of scene setting to start with, from Welcome's perspective, we're starting to think about and to address the sort of air quality crisis, particularly from a climate and health perspective. So one of Welcome's strategic priorities is around the climate crisis and recognizing that as a health crisis. And if you think about climate and health, that quickly leads you to air quality as one of the critical pathways between, the drivers of climate change and the drivers of ill health. So that's really where we're coming from when we're talking about and looking at air pollution. We're already investing a lot in the air quality space as part of our climate and health work. We're supporting research that's looking at the impacts of wildfire smoke. We're seeing an increase in wildfires and how those impact our health and the social cost of that and how that needs to be incorporated into policies. We're supporting work around energy efficiency of buildings and appliances and how that impacts indoor air quality. And we're supporting work around national and local, for example, here in the UK, net zero policies and how those policies can benefit our health. So where we can see a win-win for action to reduce greenhouse gas emissions that can also support health. And as I said, reducing air pollution is one of the key pathways by which we can see those win-wins. And we've supported a number of pieces of research around cities and climate and health, with air quality as kind of a key environmental risk from, say, coal and gas use. So we're already working on this, but we see a particular and ongoing role for research. And of course, that's what Welcome, as I said earlier, that's what Welcome focuses on. And so we really want to lean in and support all of the amazing efforts that are going on and help by providing the science and the evidence base. So one of the most recent things that we've done is an initial sort of rapid scoping on where the fundamental research gaps are with regards to climate-related air pollution. We think Welcome's well placed to kind of lean in and support, particularly on some of that more upstream research, that if we understand some of the and answer some of the deeper epidemiological, mechanistic, toxicological questions, then that can really support and help unlock a wider range of analysis of health impacts. Of course, I totally agree and accept that we already have the evidence we need to act. So we are not in any way suggesting that we need to wait. Merely, we want to support and continue to build that evidence base in a way that's policy relevant and supportive. So we presented at the Cartagena conference, we presented a report which highlights those gaps in that fundamental research, particularly looking at things like black carbon, where there's a lack of evidence, evidence needs around cumulative and combined exposures, at needs to understand the impact of different durations, intensities and frequency of exposures. And also things like the impact of climate change on ozone formation and understanding the interaction generally between heat and air pollution. So we've been working with people since that event at Cartagena to understand who's doing research in this area, and we've invited applications for this. And that's been an incredible series of conversations for us, hearing the amazing science that's going on right at the cutting edge of knowledge, and showing just the vast impact that air pollution has, not just on our respiratory system, but also looking at cognitive development, neurodegeneration, and the impacts on mental health and well-being, and how science is showing that clearly air pollution is impacting all aspects of our lives and our well-being. So that's some of the work that we've got underway, but we are planning much more. And we have planned investments in the future for the nexus of climate health, air pollution, and focusing particularly on super pollutants. We see super pollutants as a really critical space for the climate and the health argument. And super pollutants have a greater warming potential than carbon dioxide. They're responsible for about 50% of the warming to date. And a number of them are critical air pollutants, so black carbon and ozone, and also methane as a key precursor to ozone. So we're planning to invest in that space. Methane, as I say, is a precursor to ozone, but also because of co-emitted pollutants. And we heard in the presentation earlier from the Philippines, we saw benzene up there, and some other of the BTEX groups that are co-emitted pollutants across the fossil fuel supply chain from methane. So these are critical health harming air pollutants. We've supported work in this area already to work with experts to understand and identify potential pathways between methane reduction and health co-benefits. And we had some workshops earlier this year to identify evidence needs, and crucially looking at where the evidence is needed in the context of policies and where that can really support driving action. And we've got a range of applications coming in for that, so we're hoping to support work soon. On black carbon, obviously that's a key constituent of PM2.5 and one of the climate super pollutants. And we've started our work in this area, I'm really pleased to say, by supporting the WHO air quality team to undertake a systematic review of evidence of the health harms. The last systematic review was in 2012. There was insufficient evidence to set global limits, but there's been a wealth of evidence since then, so it felt like the right time to support another systematic review. We're also working with the Clean Air Fund, who are a central player in the climate and clean air space, and we're working with them to develop a package of black carbon activities, research, but also the advocacy, the dissemination, the communication that needs to go alongside research in order to have maximum traction. So we're working with them to support and develop a very ambitious package of activities around black carbon. We'll be doing the same for ozone later this year, and particularly, as I mentioned earlier, this critical evidence gap around the interaction between heat and ozone and the potential negative feedback loop that we might see with increasing sort of climate change and heat in terms of ozone impacts. And I think the last thing I wanted to say on our sort of particular focuses around pollutants is that I've just mentioned our single pollutant focus, and that's really important, but we're also going to be supporting research and work around a multi-pollutant approach, understanding real-world exposures so that we can make sure that we fully understand the health impacts at an individual and a population level, and also, crucially, we understand the impacts of policies that we're creating and how sort of single issue or single pollutant policies might land and might impact in that real world exposure to make sure that we're not seeing any trade-offs or side effects that we don't want. One of the overarching things that Wellcome supports and commits to throughout all of its research is the transdisciplinary and policy relevant nature of what we do and who we support. So it's incredibly important. Most of the work I've just talked about and most of the work that we do in the climate and health team is transdisciplinary policy relevant. So we really require and support researchers to work with wider stakeholders to ensure that work is policy relevant. And again, I think that's something that really struck me at the conference in Cartagena, was seeing how the scientific community were coming together with the broader community and the role that evidence can play when it's the right place, the right time, and in the right sort of format. And I think lastly, I'll just say that from our perspective, we're really, we think the climate and health lens is incredibly important. And we've been working very closely with a number of folk in the climate community to bring them into this discussion. Super pollutant, the super pollutant work I've been talking about is particularly interesting, a particularly interesting intersection of climate and air quality. And at the moment, it's largely a climate space. Health is referenced, but at a very high level. And there's huge momentum from a climate perspective. And we're really wanting to kind of support that initiative by bringing the health evidence into the discussion and ensuring that we can help drive and accelerate action, but also making sure that outcomes are both positive for climate and for health. And we think by bringing together climate, health, air quality and super pollutant agendas, we can go further and faster by aligning those collective goals. Thanks very much. Maria, I'll hand back to you.
Thank you. Thank you so much, Rachel. And you're right, something magic happening in Cartagena. And among the magic things is that it created this community of people giving different pieces of the puzzle, and the research you have just described it is very important and strategic, because we need to make sure that nobody will be able to say, we didn't know, we didn't have enough evidence. So that argument is over. So thank you again for being such a strategic partner. Now we move to another very strategic partner as well, with a different perspective. We have the European Lung Foundation, and with us, very lucky to have the chair of this European Lung Foundation. You know how important the voice of the professionals and the professional associations is, and therefore I give the floor now to Dimitris Kontopidis for sharing with us the experience from his association perspective. So Dimitris, you have the floor, please.
Okay, hello from Greece and hello from European Lung Foundation that I'm chair now. I'm very happy to be here, and I was also very happy to be together in Cartagena to make a kickoff of this collaboration and these ambitious goals. As you possibly know, European Lung Foundation is representing patients, and actually we are citizens having a chronic disease. I'm also cystic fibrosis patient, and I have the privilege to know how their pollution affect my lungs, my life. But there are millions of patients with lung condition that faces challenge every day, and we need to raise awareness to this kind of population regarding the air pollution problem. So, of course, their voices must be heard. So if you go to the next slide, generally in European Lung Foundation, we co-design the policies, and we believe that the people with lung condition should take part of the decision that affect their health and treatment. So this is a good example that we want to address regarding the air pollution. So in order to achieve this, we have a big network, a network of patient organizations across Europe, from every country, from different disease. And of course, we have a lot of individuals who live with a lung condition, and a lot of times is representing families, because there are carriers also in the same family. So this is the network, so we can engage a lot of people among our actions, and we take a lot of insights of what they are facing. And in order to raise these patient voices, we have 4 pillar actions. that I would like briefly to mention. First of all, we collaborate with our scientists, with pulmonologists and researchers in order to provide evidence-based information and to help patients to understand in easy language what's about. And this helps a lot to empower the patients. Also, we encourage and we train patients to make the personal storytelling part of the advocacy role. And we have seen that it helps a lot of times to deliver the message and to deliver the message broadly, not only in a country, but in the national way. For this reason, we try to keep opportunities like this opportunity collaboration regarding the strategies on air pollution. And finally, we also make connections with patients, with policymakers, even in local states or through European Parliament that we have also an office there in order to keep this connected. So if we go to the next slide, it's our strongly belief that if we take advantage of this patient voice and if we educate and empower them, we can help a lot to cut the health impacts of air pollution in the goal that we have set together by 2040. And of course, this is the responsibility that we have as organization to take this part of actions. And it's very important and it's a democratical way to hear the patient voice regarding something that affect their health. So if we go to the next slide, we have some actions that we can deliver to make stronger actions for healthcare through public engagement. And in the next slides, I will tell you very briefly what we are actually doing. You possibly know, and the persons that have been in Cartagena, we have seen live a campaign that we have. It's a big project regarding the breath clean air. So we go to the public, we go to the field to raise awareness to the citizens and to make with some stories the connection and to explain what's about. So this awareness campaign, it not only connect the people, but also it connect the local associations that help to make it happen. If we go to the next slide, so except from the public that we work in the field, we work very much with the schools. And we have in the same awareness campaign, we go to schools to make some small lessons in easy way to understand what's about. We make measurement tests regarding their lungs. And now we can, we can add some information and details about how the air pollution it affects their life. And it's very important because like this, we can work in small ages that they have a lot of willingness to take actions, and there are a lot of volunteers there. Let's go to the next slide. And the other pillar of actions is the cities. It's a lot of interest regarding the mayors in the local cities to take some actions, and we have already the connections regarding these programs, the prevention program that we have with the lung tests. So we expand the conversation regarding air pollution and how this have to be part of the prevention that already we are doing. So this was the three ways of approaching the communities, the local communities, an international way. And we have already take some grants to give us awards in project that is directed, is addressed regarding this priority, the air pollution. And we hope that during the year we will have some awarded projects to encourage local communities to find the way that will be more effective in their country, in the condition and the challenges of national challenges. Next slide, please. Finally, we dress all of this with a strong connection that we have policymakers. I already said that we have an office dedicated in Brussels to do this. And this year we have created a team with MEPs regarding the health of the lungs. So now we believe that we have a strong network there that we can take advantage of using in this direction with air pollution and how we can raise it in European Parliament when we have these KPIs or the results that we want to have after some months. So more or less, this was the kind of actions that we can do. It's crucial that we understand that the public engagement will help us to make this happen. And first of all, we need to understand why the air pollution can impact their lung health and that it's connected with their lung health. It's not something about, make it green or a trend that we want to say. It affects their lungs. It affects not only their lung, also their heart. For this reason, we have a collaboration in Cartagena with Health Foundation also. And when they are aware, then they can act and to make the domino multiply effect. It can happen then by itself with a less energy, because they will understand the meaning of what we are doing. Sorry for my bad English. It's also a challenge that we have to overcome. But we are here to join forces, take advantage of the network that we have, families, carriers, and patients that are more sensitive, and they hear more when they see a threat that could make worse their health.
Thank you so much, Dimitris, and your message was very, very clear. For me, the English was perfect as well. No problem at all. You passed the message very well, and I'm very happy that we have complemented with the 4 presentations, different perspective from different angles. The patient's perspective is extremely important. I think we are on time, and one of the ways to be very successful on a webinar is to prove the participants that we are able to start on time and finish on time. So I see that there are many questions or several questions in the Q&A. My colleagues are telling me that after this webinar, we will be sending an email trying to address your questions, because I'm afraid we will not have time now maybe to go into detail on those. But I think the purpose of this meeting, this webinar, is achieved. We have a big network of collaboration, many people interested in maintaining this engagement by all of you. And we will have another one this afternoon for people living in other parts of the world. So if you are interested, please join as well. I want to thank you very much for this participation and engagement. I will just give the floor to Heather for a couple of minutes, Heather, to finish on time, on some wrap up and next steps. And as I say, we will try to send all the presentations and addressing the questions by email to all of you. But over to you, Heather, and thank you again for this fantastic webinar and participation. Heather?
Many thanks, Maria, and many thanks to all the panelists. Many thanks to all of you for joining the webinar. Indeed, as Maria alluded to, we will be sending a follow-up email with some responses to the questions that were raised in the Q&A, as well as attaching the presentation that was given here today. We have recorded this, so this will be online. Please do check. A variety of resources are available online. As I mentioned, those infographics and communication materials will be out soon, and we really need you all really chiming in for clean air because it is a collective problem. And do try to encourage other partners to commit to the pledge so that we can have a big splash on September 7th about all those people making commitments to clean air. So thank you all again, and thanks to our partners as well for their great contributions to this webinar. Wishing you all a lovely rest of the day. Thank you.
Thank you so much, everyone. Special thanks to the panelists. Thank you so much. We didn't lose any participants, so we did something good here. Thank you all.
Ciao, ciao.
Thank you. Bye.
And special thanks as well to Paul.